What role does cultural context play in self-care for women from diverse backgrounds? If you are curious about how cultural context shapes self-care practices for women from different backgrounds, you are about to uncover some fascinating insights. Let us explore how culture influences the way women take care of themselves. First, it is important to understand that self-care is not a one-size-fits-all concept. It is deeply influenced by the cultural norms, traditions, and values of a society. For instance, in Western cultures, self-care is often seen as an individual pursuit, focusing on personal routines and self-improvement. This aligns with societal values that emphasize autonomy and self-reliance. Women in these cultures might engage in wellness trends like fitness routines, mindfulness practices, or therapy to take care of their mental and physical health. In contrast, collectivist cultures, such as those found in many Latin American and African societies, view self-care as closely tied to the well-being of the family or community. Here, women often find fulfillment and mental peace in supporting their loved ones. For example, in Latin America, self-care practices revolve around familial obligations, and traditional healing ceremonies or shared meals serve as tools for emotional and spiritual restoration. The way self-care is perceived and practiced also varies significantly due to economic and social factors. In societies where self-sacrifice is highly valued, personal self-care might be seen as selfish. Gender roles play a crucial part as well. Women in patriarchal societies are often expected to prioritize caregiving over their own needs. This cultural expectation can leave little room for women to focus on their own self-care. Moreover, economic disparities can further complicate access to self-care resources. In low-income communities, access to wellness resources like gyms or therapy is often limited, making it harder for women to engage in self-care practices that are common in more affluent societies. The globalization of wellness trends has led to a blending of self-care practices across cultures. For example, yoga and mindfulness, which originated in Eastern cultures, are now widely practiced in Western societies. However, this cross-cultural exchange also raises concerns about cultural appropriation, as practices can lose their original depth and significance when stripped of their cultural context. For Latinx women, self-care practices that align with their cultural identity are particularly important. Therapists and psychologists work to support these women by incorporating cultural elements into their self-care routines, such as traditional healing practices and community-based activities. This approach helps women honor their heritage while promoting their personal well-being. In summary, the cultural context plays a vital role in shaping self-care practices for women from diverse backgrounds. It influences what self-care means, how it is practiced, and the barriers women may face in prioritizing their own well-being. By understanding and respecting these cultural differences, we can foster more inclusive and effective self-care practices that honor the unique experiences and traditions of women around the world.